Hello, my name's Neil Pearson. I'm a physical therapist, yoga therapist, and clinical assistant professor. Most of my work is with healthcare professionals, teaching them and yoga teachers and people in pain about how the pain systems in our body work. When we're faced with difficult health issues like chronic pain, greater knowledge becomes very important. Since the early 2000s, research and clinical experiences have taught us more about pain, how the systems work, and also taught us how to teach people who have chronic pain. These Overcome Pain Self-Management education sessions are intended to provide you with more knowledge and with specific strategies to help you to move towards 3 goals. And these goals are less pain, better ease of movement, and better quality of life. Whenever I have a chance to talk to people about pain, I always start with this slide. Picture of someone with a paper cut. It's interesting when you consider a paper cut, there's really not that much damage to your body, but strangely, they can hurt a lot. So here we have a situation where you have a small injury to the body, but significant pain. And what we should take from this is the idea that pain is complex. It's not as simple as we normally think. Now, researchers being researchers, what they decided to do was check to see, do people say paper cuts hurt more at work, or do paper cuts hurt more at home? And what they found, of course, was that people reported paper cuts hurt more at work, which once again tells us pain is complex. As we start talking about pain and understanding it better, we want to start with the question, what is the purpose of pain? You may never have considered that before. And most of the time when we answer this question, we come up with the idea that the job of pain is to tell you that you've been damaged. But really what it comes down to is that we can answer the purpose of pain in one single word, and the word would be protection. The purpose of pain is to protect you. The purpose of pain is to get you to stop doing what you're doing or to change your behavior. It's a lot like a big stop sign or maybe a yield sign. Now, your body has many ways to protect you. Pain is just one of them. Your body can protect you by giving you muscle spasms. If you imagine a person who's had a car crash a few days ago, all the muscles of their neck would be holding on tight. And often we think the reason the muscles are holding on tight is because it hurts so much. Well, that's part of it, but the main reason the muscles are holding on tight is because that will stop you from moving your neck too. That will help you get better. So we can see muscle spasms like pain are another protection mechanism. But now your body's even more sophisticated than that. Instead of making muscles spasm, what your body can do is it can make muscles turn off. Can you remember a time when you've been walking along and you smack your kneecap on something? So these signals go flying from your kneecap through your body up to your brain to give you pain, to get you to stop walking on your leg, to protect you. But if you decide to try to walk on your leg anyway, you've probably noticed that your leg felt weak. All the muscles of your leg felt like they wouldn't hold your body up, and that's protection. Sometimes people can remember a situation like this when they smacked their thumb with a hammer. You hit your thumb with a hammer, but then you try to use the rest of your hand and your whole hand feels weak. So pain protects you, muscle spasm protects you, weakness in muscles can protect you, your body can protect you by changing your posture. Your body can protect you as well by giving you other unpleasant sensations besides pain. And your body can protect you by giving you strong emotions, anxiety, fear, anger. All these things can be protective mechanisms. And I'm sure you've noticed that your body can protect you by making everything go on guard. So that sensation that you get when something happens and you hold your breath. All these things are protection options that your body has. There's a group called the International Association for the Study of Pain. And they've come up with a definition of pain to try to help us understand it better. They say that pain is an unpleasant sensory and emotional experience. It needs to be unpleasant because it needs to get our attention. It's sensory and emotional because there are 2 kinds of nerves in your body that will get excited when you damage your body. So if you stub your toe, signals go flashing from your toe up through your leg through 2 kinds of nerves. And when they go up to your spinal cord, they go up through 2 different pathways. When they get to your brain, one pathway goes right to the emotional part of your brain, and the other pathway goes to the sensory part of your brain. So it turns out you can't have a sensation of pain with having an emotion attached. Now they said that pain is also an experience. That means that all of your experiences in the past will change your experience right now, and all of your predictions of experiences in the future will also affect how you experience pain right now. which once again comes back to this is a very complex thing. The other thing that they said in their definition was that pain is associated with actual or potential tissue damage. So actual tissue damage makes sense. Potential tissue damage often gets people wondering. So imagine if I pull my finger back like this. Take my word for it, right now it actually hurts. But if I let go of my finger and move it around, the pain will stop. So that means I had pain without there being damage. What happened when I pulled my finger back was my system said, if you keep doing that, you're going to cause damage, so stop. So it did that, it said stop, and it got me to stop by giving me the pain. Now the other thing that these researchers have said to us is that pain is described in terms of damage. A lot of times the words we use to describe pain suggest that there's actual damage happening in our body. So we use words like it's cutting, it's ripping, it's electric, it's burning. All these things suggest to us that there actually is damage going on in our body. So as this definition points out, pain is an experience. Experiences are very powerful. And maybe the best way to understand the power of them and how long that they can last is to consider, maybe you've heard a story of someone telling you that they've drank too much tequila at some point in their life. And now years later, they can't even think about the tequila without feeling sick again. So years ago, they did this thing. They drank this tequila, the tequila ended up inside their body, and their body decided that they needed to be protected. And it protected them. It created an output. It made them really sick. And now, years later, just the thought of it can make them feel sick again. The thought of it can make their protection mechanisms turn on again. So that tells us that pain, like other protection mechanisms, is going to be a long-lasting, powerful thing. The other thing we need to understand about experiences is that experiences are unique to individuals, which I know you already know. The last thing we need to understand about experiences is that we have some influence over them. As you gain more of this knowledge, hopefully the strategies that we'll be able to provide you will show you exactly how you can influence your pain experience. So to simplify this, maybe the best thing to do is to consider that your pain system is an alarm system. It's an alarm system that can warn you when you've been damaged. It's an alarm system that can warn you when you're approaching damage. And this alarm system is something that can warn you even if you're in a situation similar to a time in the past when you've had pain or when you've needed to be protected. At this point, what I'd like you to do is to consider the information you've heard up to this point. Decide whether it makes sense to you and see how it relates to your specific individual pain experience.